Hello, everyone. My name is Dr. Michelle Thompson. I'm the medical director of lifestyle medicine for the University of Pittsburgh Medical Center, as well as associate professor at the University of Pittsburgh School of Medicine. Today, we are going to be talking about the lifestyle medicine and integrative medicine elective and give you a little orientation about what to expect when you are on service with me. I'll give you a quick little background about me. I've been doing this work for over 20 years. I changed my own diet, exercise, and lifestyle 34 years ago. I trained at LECOM in Erie. I did my residency at UPMC Mercy, and I have been with UPMC for 20 plus years. My background is family medicine. I'm also board certified in lifestyle medicine, integrative medicine, and mind body medicine. And I am 100% a consultant now with our Department of Lifestyle Medicine. And we are also here today with our medical students from the University of Pittsburgh School of Medicine. And I'm going to let Jess introduce herself first and then followed by Claire.
Hi, my name is Jess. I am a second year medical student.
Hi, I'm Claire, and I'm also another second year medical student.
And I'm so happy that they're here with me today and that they've been on service with me and inspired this conversation. So to help you to have an easier approach to your elective with us. On this rotation, we come back to ourselves. We create our own lifestyle medicine prescription, and we really kind of come back to taking care of ourselves. And I'm going to walk through a couple of slides. I always want you to remember to not forget that you are the most beautiful and expensive thing that you are ever going to own. And so we're going to talk about self-care. We're going to talk about all the tools and techniques that we can use to understand and better know ourselves mentally and physiologically. And then I love these books because, one of the big things that I talk about on this rotation is not what is wrong with the person, but what happened to them. But why? But why? We always come back to not just they have hypertension, but why? They have depression, anxiety, but why? And so oftentimes we look at some childhood traumas and what has happened to people along the way, and that really does lead into their story. And so we know that the genes load the gun, but your environment pulls the trigger. And so your genes are not always your destiny. And there are a lot of things that we can do in lifestyle, integrative, and mind body medicine to make changes in patients' lives. I always want us to think about our own selves and our own emotions. And so I encourage people to look at the wheel of emotions and think about what we're feeling in this moment and not resisting these emotions, even ones we may consider as bad or angry or frustration or agitation or disappointed, but really feel those feelings because that is a lesson to our bodies to be able to move those through us and to be able to increase our emotional intelligence along the way. We know that physicians with a regular mindfulness practice enjoy a reduced stress response, rumination, physical illness, depression, anxiety, burnouts. These physicians also experience improvements in perceived empathy, patient adherence, patient outcomes, reducing medical errors along the way. And so one of the really big important things that I think that we need to do more of is trauma-informed care, thinking about our language and communication, providing choices to our patients, having sensory-friendly environments, actively, deeply listening to our patients, being completely present, 100% mindful with the patients, and then thinking about the implementation of this in our training, as well as our own self-care, and then understanding de-escalation techniques. I think it's really important for us to understand that lifestyle medicine is sweeping the world. And I won't just say the United States, but beyond. There are over 122 hospital systems in the United States that have lifestyle medicine somewhere embedded in the system. At UPMC, we have it in our medical school, we have it in our residency program, we have our lifestyle medicine department, and we have our lifestyle medicine interest group. A lot of our trainees are coming out and actually graduating, being able to sit and be duly board certified in their area of specialty, namely family medicine, internal medicine, pediatrics, and physical medicine and rehab, and then sit for the lifestyle medicine boards. And then they're going on and taking on program directorships because the world needs more lifestyle medicine. I've been fortunate enough to speak globally at the International Conference of Lifestyle Medicine in Hayel, Saudi Arabia. And so I really just want to showcase the fact that lifestyle medicine is important for ourselves as well as the entire world. We're going to break down what is true life-changing medicine that we talk about at University of Pittsburgh Medical Center. We're going to talk about lifestyle medicine, mind-body medicine, and integrative medicine. Here is our team. So it started with just me, and I began to build this program about 5 years ago. And now we have 6 physicians, a physician assistant, 2 dietitians, 2 health coaches, as well as our project manager. We have hired on 2 of our graduates from our family medicine residency training program, and we're really hoping to continue to grow this. And so the 6 pillars of lifestyle medicine, what are they? This is what you're coming in here to learn about. So thinking about nutrition, movement, managing our stress, relationships and connection, making sure that we're getting a good night's sleep, and we have a mindful use of substances. And so every time you go in to see a patient, you will ask, what's going really well for you? What are you struggling with? How are you doing with sleep, exercise, nutrition, stress management, substance use, and connection with others? And so we want to celebrate patient successes. We want to see what the struggles and hurdles are. We know that even in our own lives, these 6 things are really hard. I'm struggling with sleep right now. And so that's something I speak very candidly about, that when we don't get a good night's sleep, then we may have more stress. We may not make the best food choices. We may be too tired to move our body and connect well with others. And then we may grab a substance that we wouldn't have otherwise grabbed if we got a good night's sleep. So all these things matter, and it's about process and not perfection. And so we think about what that looks like for our patients and in ourselves. Lifestyle medicine is a medical specialty. It utilizes therapeutic lifestyle interventions as a primary modality to treat chronic conditions, and applying evidence-based, I'm going to say it 3 times because it's super important to me, that we're really looking at the evidence behind what we do and looking at the whole person prescriptive lifestyle change to treat, and in some cases, reverse these conditions. And I do a lot of deprescribing. I'm what is known as a deprescribing specialist. So my specialty is really trying to help patients get off of all their medications and not need us doctors, because that's the goal, to put them back into the driver's seat of their healthcare, to help them be their own best healer, to help them listen to their inner wisdom, their inner knowing. Lifestyle medicine is governed by the American College of Lifestyle Medicine, and we reviewed the 6 pillars. So in our lifestyle medicine department, what you get to experience is watching lifestyle medicine assessments. You get to see group medical visits. You get to see nutrition services. You get to see coaching visits. We offer 36 different types of group medical visits that you can participate in: intro to lifestyle medicine, diabetes, hypertension, brain health, digestive health, gut health, microbiome, men's health, sleep, cholesterol, fatty liver, mind-body skills groups, food as medicine, culinary medicine, emotional eating, looking at food sensitivities, looking at hypertension, things like women's health, PCOS, menopause. And we do teaching kitchens. We think about planning our meals, eating out, meal prepping. We have weight management with and without the GLP medications. We have grief support, addiction habits, and not just thinking about substances, but also work addiction and screen addiction, et cetera, tobacco, eating healthy on a budget. We're building movement groups. Those are coming soon. Things like lifestyle medicine for inflammation, and just anything. I always say, if you build it, they will come. So when we see a common diagnosis, we create programs for that. Lifestyle medicine is not preventative. That's its own specialty. It is not functional medicine. They use a lot of testing as well as a lot of supplements. It's not naturopathic. They use a lot of herbal remedies. And it is not integrative medicine, although it lives within. Lifestyle medicine lives within integrative medicine. And then mind-body medicine really is that connection of your mind and your body, and thinking about how we can make the change. We know what we need to do, but how do we do it? It's really tough to do it. So integrative medicine, some of you may be doing an integrative rotation with us, and that takes it a step further. We look at things like yoga as medicine, meditation, mindfulness. You'll learn to do breathwork practices. You'll learn mindful eating, mindful movement, shaking, dancing, autogenic training, energy medicine, exercise, genomics, nutrition, aromatherapy, botanicals, looking at sleep. Sleep is a driver of all health, as we said. Things like culinary medicine, self-care, environmental factors. We're building a program on environmental toxins right now, neuromuscular, osteopathic, manual medicine, sound therapy. I'm actually in a documentary called Going Om, which looks at sound as healing and also the importance of silence and how we could utilize that in our healthcare journey. I'm going to turn it over to our team here to give you some helpful tips about what they have found beneficial along the way.
Yeah, I can talk about some of the logistics really quickly. So, if you're watching this video prior to fall of 2026, there's a chance that you might not have been in a clinical environment with Epic yet. Although I know a lot of people are familiar with it through research and other things, but just in case you're a total beginner, I like to start by going to myapps.upmc.edu in order to get access to the Epic Hyperdrive, which will then be downloaded. Can we get to the next slide, please? Then you just click on the most recent download. You have to do this every time you click out of Epic. And then for our department, make sure you put UPP Fam Med Lifestyle. Next slide, please. And then this one was a little confusing at first if you've never done it, but in order to view Dr. Thompson's schedule, you'll see on the schedule tab this thing that says UPP FabMed Lifestyle All Providers. You can actually click the drop-down menu to filter by Dr. Thompson and just see the patients for the day. I did not include the full screenshot for patient privacy. And another note here is that when you are going to join a virtual visit, there's that green camera button and tells you who's on. And make sure to double click because sometimes if you just click once, it won't open up. And then you'll be taken to a browser where you could join the virtual visit. And then next slide. One note is that when we do our group medical visits, usually it's up to us as the learners to write down all of the patients' goals and check-ins so that we can add a personal note in their note. And so usually we're going to be using one of the smart phrases from Dr. Thompson. The one we normally use is .mt group template. And then first you have to add yourself as a user in the smart phrase manager in order to have that in your system. And then once you get there, you'll be able to add it in that personal goals section. Next slide, please. So yeah, here's a screenshot. The arrows show where you can enter the goal. Somewhere in that subjective section, you could write the title of that group medical visit, such as like food as medicine or mind body meditation. And then when you're done, you can hit that accept button next to sign when signing visit. And don't forget to close out of the chart so that Dr. Thompson or whoever can finish signing the visit. And then I think now would be a good time for Jess to talk about some of the in-person shadowing opportunities in Integrative.
And I want to just add too, as you can see in this note, it says assessment and plan, no diagnosis found. That means I did not put my diagnosis in yet, and you got to that note before I got to it. And so you might have to go back to the little green circle button to refresh the note to pull that back in. So that may be asked of you as well. So if when you're beginning your charting, you see that there's no diagnosis in there yet, then no, you're probably going to have to circle back to that to update that so that it's solid. All right, off to you, Jess.
Perfect. So Claire's in the lifestyle medicine elective, and I'm in the integrative elective. One of the opportunities that we have is to shadow in person at the Center for Integrative Medicine. And so they are at the backside of the Shadyside Hospital. They are really awesome. They have a whole team of naturopathic doctors, chiropractors, anyone you can think of that you would want on an integrative team, they have access to. And I was just there this morning. I was able to go in person since most of this elective is a virtual elective. It was really nice to be able to interact with these patients in person and also just get a slightly different um, patient population since the doctors there can have their own specialty backgrounds as well. So Dr. Glick is who I worked with, and he was very kind to also connect me with other physicians that have similar interests as I do. And there's a lot of opportunity if you are interested in acupuncture and things like that as well down at the center.
Great. And so Our basis of everything we do is really around trauma-informed care. And I love this book. It was something that I personally was in the New York Times for the work that I did on doctors facing burnout turn to self-care. So transforming trauma, the path to hope and healing is how I got my board or my certification in mind body medicine. So I'd really encourage you as a human being on this planet to become more trauma informed and to really take good care of yourself along the way and check out the Center for Mind Body Medicine. As Jess was just talking about to you, this is an integrative elective also. When you're with me, I can't take out the integrative part because I cannot unintegrate myself. And this textbook really is the book recommendation or the Bible or the manual for integrative medicine. I suggest all physicians actually have this because you can look up any diagnosis and it gives you an integrative approach in addition to the traditional ideas to think about with this. Here is the way that you can access the smart phrases, the ACLM dot phrases. There are over 500 smart phrases inside of Epic that I have built. And here is the handout to go through how do you actually find that. And Claire was talking to you a little bit about that, and you can make them all your own. I can also send them all over to you if you remind me to, give you all 500 and then you have them. And then here's a couple pictures of what some of them look like. Here's one on substance use. Here's one on sleep health, and they're quite beautiful. And so it's just at the click of a button, you can put those into the patient notes, after visit summary and patient instructions. I love this one because we should all take time for self-care, even if it's just drinking water, it's moving our body, it's thinking about our emotions, socializing with one another. Some resources, the Center for Mind Body Medicine I mentioned. My website is wholeheartedmedicine.org. I have a ton of resources and podcasts that are on there for you. I would suggest listening to some of those, learning about my practice, some of the things that I've done along the way. There's things on food as medicine. There's things on recipes, as well as trauma-informed care and some of my own personal stories of, what it's been like for me along the way. And then some of the system transformation stuff that I've done. We have also the American College of Lifestyle Medicine's website that is there. We have our lifestyle medicine interest group on Instagram. So if you want to be part of that, that's open to anyone, even your families and nurses and occupational therapists and pharmacists. We have a monthly meetings that we gather in virtual or hybrid format so that we bring everybody that's interested in lifestyle medicine in the community together. So with that, I'm going to stop share. And then there are a couple of other items that we wanted to just help out with, and how to navigate the schedule. Claire, do you want to do that, or Jess?
Yeah, I could talk briefly. So normally with the schedule, we are working with Dr. Thompson from Monday to Wednesday. And so that's the general 7 to 5 period. And then Thursdays and Fridays tend to be more flexible. So for example, Thursdays you might work with Dr. Ferens or Dr. Ogadimu. And then Friday is with is it Dr. Nicholas?
Dominic. His
Dr.
name is
Dominic.
Nicholas Dominic. Yeah.
Got it, got it. Okay. So those are the Thursday, Friday ones are a little more flexible. You can sit in on their visits or also other members of our team who are so great. We have Dana, the dietitian. We have Patty, who's our health coach, and she's working with a lot of the same patients that we're seeing throughout the week. Am I missing anything else?
Trina is a health coach, as well as
Yes.
Noelle, who is also a dietitian who specializes in diabetes. So that's available to you. Caitlin Ebert, our physician assistant, who is also board certified in lifestyle medicine and practices mind body medicine. And what did we miss? Did we miss? We said Lisa Ferris, Dr. Lindsay Nakaishi. She is also a big educator, and she teaches our food as medicine, and she loves to also let you teach. So you can have the slides sent to you and you can just say, I want to teach a few slides. And we've had some of our learners that actually teach the entire group medical visit because they're that motivated and they want to practice. So, this is about your journey and how much you want to do. And so you really have to find your own way and make your own way throughout this. And you'll get as much or as little out of it as you want to. So, Jess, do you want to add anything in?
I was just gonna say in terms of like how we start the elective and like what to expect at the very beginning. The very first day, the very first visit, usually we're shadowing Dr. Thompson and whoever else is in that visit. And then after the first one, Dr. Thompson loves a hands-on approach, so we were able to go in and start our own patient interviews pretty much right from the get-go. A very big part, obviously, are the six pillars of lifestyle medicine. So we always ask those. We, in general, ask the general questions like how are the patients doing? Why are they here? Things like that. And then once we're ready, we go back to our team's chat with Dr. Thompson and we tell her that we're ready and ask her to come in. And then we present. So we present in front of the patient and Dr. Thompson. It's not scary. Dr. Thompson is very kind and, it's very helpful and in a great way to learn more about presenting. And then from there, Dr. Thompson generally leads the visit for the most part until we get comfortable to a point where she starts asking us questions. And towards the later half of our elective, she starts asking us our opinions and for assessments and plans. For the group medical visits, as Dr. Thompson said, we do have the opportunity to lead those, but when we're not leading, one of the medical students will be taking notes. So we will be noting down the patient's goals, sometimes their updates and their check-ins from the past week, or however long it's been since their last visit, as a lot of these group medical visits are like segmented, so there are a couple in a row. And then afterwards, we are in charge of inputting those goals into the notes. So that's where Claire was talking about the MT group template and the personal goal. But since there is the template, it isn't too much of it's not very complicated, I would say. It's very helpful to have the template there, and then we just input our notes.
Great. And so with the one-on-ones, I use AI, and I was also in the New York Times for that work because I've been using AI for the past 5 years, and actually have spoke on AI in many different conferences. And so we leverage that. So you don't have to do anything in the one-on-one, just, get familiar with using your six pillars and using your brain to start to think about, but why? Like, but why does this person have hypertension or diabetes or hyperlipidemia or fatty liver? And so, kind of coming back into your clinical skills and really thinking about how you can build your own, your knowledge base as you move through this. And I think that the fun thing for me is that we all work in the team-based approach. The doctors are as important as the coaches, are as important as the dietitians. The students are as important as the residents, and there's no real hierarchy. And oftentimes we'll have a medical student who has been on service a little longer, and a resident comes in, and the medical student is showing the resident what to do. And the residents are oftentimes blown away by the medical students and how much they know more about lifestyle and integrative mind body medicine than what they even know on their first day. So I think that's the collaborative approach. And I think the self care, coming back to ourselves and reminding ourselves, who am I? How am I going to take good care of myself along the way while I'm taking care of patients is really important. So I will encourage you sometimes, like yesterday, we got done early, get outside, go move your body. Do you need to go to their bathroom? Do you need to make a cup of tea? Are you hungry? Can you remember to take care of yourself and know that that self care is not selfish, and caring for ourselves is caring for others? And so really important to me that you walk away with those tools in your toolbox so that you can be successful and so that you can love what you do as much as I do along the way. Not saying it's never going to be stressful, but it's going to be fun, and you're going to really recognize the benefits of taking good care of your patients and having that satisfaction of, practicing good medicine along the way, and really listening and being there for your patients and helping them to feel seen and heard and to be empowered in their healthcare journey, which is what I think we lack a lot of. So any closing thoughts, Claire? I'll ask you first.
No, I would just say, like I've been taking a lot of notes because these are things that I'll carry with me. And I think the all the smart phrases are so great because you can save them for yourselves. And I'm even just applying them in my own life, so I think this is a great elective.
Jess?
I highly recommend following along with the group visits, especially your first few ones, to like learn honestly like what it does for you. I really like taking the step back and like having like doing the imagery exercises, and I've learned so much from all of the visits, but especially the group exercises. A lot of them are very informative. So make the most of what all the resources that are in this elective.
Yeah, so with that, I do a ton of work on physician well-being, medical student nursing well-being, worldwide well-being. And so, come have fun with us. Come back to yourself and really, decide how you're going to put your own oxygen mask on as you're, helping those around you. I always say there's no Dr. Michelle Thompson to take care of Dr. Michelle Thompson, except the one and only Dr. Michelle Thompson. And so, I have to figure that out for myself. Am I perfect? No. Am I always working on these things? Yes. And so every space I'm in, I may be a facilitator, but I'm also a participant. And so I think it's really important that we be real with ourselves. And this is a space to be vulnerable. This is a space to grow and to reimagine how you want to be in your lifetime and your career and path in medicine. So super excited to have you with us. I'm always available. You will get an email from someone a week prior with a welcome letter and some tips and tools. You will also get added to our learner chat. You will have my phone number. You will have our coaches' information, our administrators' information. And so excited to have you with us, and take good care of yourself and be well.